All right, thank you, Tom. We've got boiling temperatures and a simmering surge of cases. The number of people turning up positive with the coronavirus continues to number in the thousands.
Almost 2,900 new cases came in today. Now that's more than we took in at this time last week and is the second day in a row where this week's number topped last week's number, bending our curve back up a few notches.
And that means the pressure will remain on the state's critical care units. To help, some new ICU beds came online today, increasing capacity. But we also saw a spike of 101 more patients in the hospital. Ventilator usage came down a little bit from its record highs, as we also saw 35 new deaths added to that grim tally today. As new cases remain high in Arkansas, there's no reason now to turn back off the effort to get people vaccinated. Healthcare professionals say when it comes to those still holding out, they've seen more success in bringing the vaccine to them.
One Central Arkansas hospital is doing just that, and THV 11's Mercedes McKay is joining us now live from UAMS with how they're seeing success by vaccinating patients in their ER. Mercedes.
Rolling, Marlisa. UAMS has been giving out the vaccine right here behind me inside their emergency department since June. The goal, to provide more access to people who may not have had the chance to get vaccinated.
A lot of times in the ER, we feel like we may not be making a difference for each patient, but if we're giving a shot, we really feel like we're making a difference for that patient.
It's a place known for its high-paced atmosphere and a spot people turn to in times of crisis. But behind these doors, UAMS doctors are not only helping patients with their immediate health problems, but also protecting them from possible risks when it comes to COVID-19.
In early June, when we saw that Arkansas vaccination rates were pretty low, we thought maybe that we could utilize the ED as a way to get people who otherwise don't have access to health care the vaccination.
Since then, Dr. Carly Easton says they've given 137 vaccines to patients who came through their ER doors. But she says it's not about the numbers, it's about the impact.
At least by the end of May, the people that really wanted the vaccine had already had it, and so we had to go to patients rather than waiting for them to come to us.
It wasn't always physicians like Dr. Easton questioning patients about their vaccination status. First-year medical students like Luke Leffler and Kiko Hadar also helped in this effort.
Being able to help kind of on the front line with the pandemic. Yeah, we hopped right on the opportunity to jump in.
If a patient hasn't been vaccinated, these med students help educate and inform them.
There was a range of reactions, as you can imagine. There were some people that were really kind of enthusiastic about getting the vaccine, and it was more of an access problem that we were solving.
While every answer isn't a yes, they say every shot feels like a victory.
Making an impact in the population that's coming in, I think, can really help in the long run, even if it is just a few numbers each day.
Even if it's just one more person, that whole shift that we work to get vaccinated, it feels like a small step towards getting back to some resemblance of normalcy.
If you still need to get vaccinated, UAMS offers them here at their emergency department around the clock. You can also make an appointment at UAMS's vaccine clinic. We'll post a link to that on our website at thv11.com. Live in Little Rock, Mercedes McKay, THV 11 News.